I am Dr. Ravindra Sanglikar Pulmonologist. I have done my MD from Nair Hospital. I am having 26 years of post MD practicing experience. In my Sanglikar Pulmonary Care Center, I treat the TB patient whatever the extent, that is from normal pulmonary tuberculosis to the brain tuberculosis, as well as MDR and XDR TB patients. I give treatment to the asthma management, as it is a pediatric asthma, as well as the asthma during the pregnancy and severe asthma. I am having the pulmonary function test for management and judgment of an asthma. In my pulmonary care center, we do the treatment of an ILD, as most of the patient now, because of an industrializations, pollutions, and they are suffering from the interstitial lung disease, and they are untreated for a prolonged time, and such patients comes to my center. I give them treatment with their rehabilitations also, and their patients are very well maintained on the treatment. In Sanglikar Pulmonary Care Center, we treat the snorer, that is the snoring patients, which are most of the time suffering from what is called as a obstructive sleep apnea syndrome. So we have the mini as well as the polysomnography. We detect the patients which suffering from the sleep apnea syndrome, and we treat them with the help of BiPAP or the CPAP. In case of the asthma, we try to find out the cause for the asthma, that is the allergic etiology, by doing the skin allergy test, and we have the full panel of skin allergy test for the aeroallergen, food allergen, and these, by detecting, we also give the immunotherapy for these patients. And final and very important, that most of the patients of the lung diseases, they are suffering, and we cannot sometimes detect them by external examinations or by clinical examination. So in such cases, the bronchoscopy sometimes help, and we have the video bronchoscopy. So we do the video bronchoscopy and detect the cause for what is the lung diseases suffering from, like lung cancer, tuberculosis, or any other immunological disease, and we treat accordingly.